Today we're going to demonstrate a particular use of ozone. This is called major autohemotherapy combined with ultraviolet blood irradiation. These are the pieces of equipment that we're going to need. We're going to shave the leg of the dog or cat that we're doing because we want it to be done sterilely. So we have our clippers. We have an IV catheter placed. You don't have to use an IV catheter, but I find that if you have the IV catheter placed, there's less chance of the animal moving and pulling the needle out of the vein. So we want it to be done sterilely. So we have our clippers. We have an IV catheter placed. You don't have to use an IV catheter, but I find that if you have the IV catheter placed, there's less chance of the animal moving and pulling the needle out of the vein. We're using a small gauge IV catheter. We're using a 24 gauge with a injection cap. We have a little flush here to be able to flush the catheter. Already prepared, we have a little bit of heparin. We're using a 1,000 unit per mil concentration, and we have a 3 cc syringe with a 22 gauge needle. Now we chose this size syringe because the amount of ozone that we're going to use is approximately 1 mil per 5 pounds of body weight. So this dog weighs 14 pounds. We're going to draw 3 mils of blood. So we already have our syringe heparinized, and we're going to draw the 3 mils of blood. This is the bag that we're going to be using to put the blood into. We already have saline in there. It's called an O3 bag. We have 2 hemostats that we're going to use because we're going to need to clamp these, which we'll demonstrate shortly. And this is a quartz cuvette that is used when we put it through the ultraviolet portion of the machine. All right, so now what we're going to do, we have everything laid out. We're going to go ahead and place the catheter in this dog. And while Alyssa is shaving the dog, I'll give you a little bit of history on this dog. The owner said he jumped off of the bed last night and he became painful in his back. We've already done a thorough physical exam. We've taken radiographs, and we could see that his spine literally has an S-shaped curve to it on the ventral dorsal projection, and he has a fair amount of degenerative disc disease as well. So we know we're dealing with a problem that has inflammation associated with it, and that's why we're picking the ozone as one of our therapies, is to help reduce inflammation, to increase oxygen, and to start promoting the healing process. So this is going to go ahead and place her catheter. She already has her tape cut. Go ahead and flush the catheter to make sure it's patent and that the IV is set and well. Well, that's good. The next step is we're going to draw the amount of blood that we need. We've already heparinized our syringe. I like to draw it from the jugular vein. I like to save my leg veins for other catheter usages. And if she feels she needs to, she can shave the neck. Now, if we had a large dog and we had to draw a larger volume, we would use a catheter, a butterfly catheter, in order to be able to draw a larger volume of blood. But you can see that was very simple. Now she's going to take and put the blood into the bag. You inject it kind of slowly. You don't want to damage the cells. And she's mixing it. Very good.
So now that we have our blood and our saline, we're going to go ahead and draw up the necessary ozone to do our treatment here. We've set the machine to 45 micrograms per milliliter, and we really only need 3 cc's or 3 mLs of ozone. So Alyssa will just infuse that amount into our blood bag and discard the rest of it using the ozone destruct on the Ozonet ozone generator. And once we've got our blood in the bag, we're going to just gently rock it back and forth a little bit, make sure to get all of the ozone absorbed into the blood. And once we've done that, we can go ahead and connect our cuvette up to the O3 UV bag. We're going to connect the male side of the cuvette to the female port on the bag, and then after we've done that, we'll connect the female side of the bag to the male port on the bag. And now we've got our line completely primed. We can go ahead and set the cuvette in the device, in the ultraviolet blood irradiation device, and put the other side into the infusion pump, and we'll be ready to go here. So you just press the cuvette ends firmly up into the UV machine. There's a couple holders there that you'll notice when you do that, and then insert the line firmly into your infusion pump. Once that's done, we'll go ahead and turn our ultraviolet blood irradiation device, this is the Chimp UV, on, and we're good to go. We're going to go ahead and set our infusion pump for the correct volume that we're treating and at the correct flow rate that we want, and then we're just going to go ahead and let it run. And once that's completed its cycle, we'll go ahead and take that blood saline mixture back to the patient and infuse it into the patient.
So our blood is now ozonated and gone through the UV machine, so we're getting ready to put this back into our patient. So Alyssa is clamping the female side of the catheter, and she's going to remove this port here, and she's going to be able to attach, we're going to use a 20 cc syringe. It's a sterile syringe, and we're going to push all the remaining blood out of the tubing back into the bag. Okay. Now she's going to clamp the other side. Now she's going to draw up the blood that we're going to put back into our patient. And like any IV injection, you're going to make sure there aren't any air bubbles. Doesn't have to go particularly slow, we just don't want to damage the cells. So she's injecting about a mil every 10 to 15 seconds. You can see why this is a lot easier when you have an IV catheter in. The animals are typically very comfortable when they're getting their injection. And other than having the blood drawn and getting a catheter placed, it's pretty innocuous. And that's it. We'll take the catheter out, put a little bandage to go home, and he's all done.